Hi, I'm Pauline from Haemophilia Foundation Australia, and today I'm talking to Professor Cedric Hermans from Saarloup University Hospital in Brussels, Belgium. Cedric, what's brought you to Australia?
While contributing to this great meeting that took place over the last 2 days, sharing experience, meeting beautiful colleagues, nice people, great experience.
Can you tell me a little bit about what you've been presenting here at the Australian Bleeding Disorders Conference?
Well, first I try to give an overview of the quickly changing landscape of different treatment options for patients with hemophilia. So it's clearly fascinating. Patients used to be treated with concentrate of factor VIII to factor IX given intravenously. But this is quite challenging for many reasons. This treatment has to be given IV, they have a short half-life, rapidly eliminated from the blood. And on top of that, many of them do induce the generation of antibodies, so they are not well tolerated. Today we have plenty of different treatment options. We have long-acting factor VIII, factor IX, even super-acting factor VIII. We have this beautiful bispecific antibody that mimics factor VIII, can be given subcut. We also have plenty of very original treatment options. We call them the rebalancing agents. This is a very bit complex. So how did they work? They do not replace factor VIII or factor IX, but they help to generate what we call thrombin. Thrombin is key. Thrombin helps to generate the clot. And these agents help to generate more thrombin. The good news is that they are given subcut, again, and they can be given for hemophilia A, hemophilia B, with and without inhibitors, so really promising. And then we have gene therapy for hemophilia A, and certainly for hemophilia B, which looks quite promising. And we had very good testimonies here from patients who underwent gene therapy, even here in Australia. So clearly things are changing, and the good news is that patients cannot be on prophylaxis, and what we expect is to have zero bleed in our patients and a normal life, physically and mentally.
Would you say that the treatments for other bleeding disorders are also progressing, other than haemophilia?
Well, yes, less quickly and maybe less efficiently, but we see more and more treatment options, including for patients with von Willebrand, some rare clotting factor deficiency. Yes, but it's clear that for the moment, patients with hemophilia certainly do benefit from more rapid advances, but I'm quite optimistic for the other patients.
I know that you're also very well versed in how the treatment landscape is changing for women and girls with bleeding disorders.
Yeah, well, first of all, what we need to do is to make sure that we identify these women. Clearly, there is a lack of diagnosis. Many have not been diagnosed or poorly diagnosed, so I emphasize the importance of awareness and proactivity. So we need to do everything possible to make sure that these ladies who have bleeding problems are diagnosed. And for them, especially if they are carriers of hemophilia A and B, I think we have excellent treatment options today. The problem is that many of these treatment options have not been extensively validated. Sure. But clearly, we are now getting data showing that they work in women and girls with hemophilia. For other disease, it could be a little bit more complicated, for von Willebrand, for factor VII deficiency, 11 deficiency, but again, I think we have other treatment options too that can certainly help all these women.
So the 2026 theme for World Haemophilia Day is about the journey to diagnosis and the importance of that diagnosis. Can you tell me a bit about how we can go about improving diagnosis, not necessarily just in Australia, but around the world as well?
I think it's a great and important topic and a fabulous initiative. Why? Because there are so many patients or so many persons, I would say, who present with bleeding symptoms. But there are fewer persons who have been diagnosed with a bleeding disease. So there is a huge gap. Why? Because many persons do present with bleeding symptoms in their daily life. Sometimes they underestimate the importance of this, or even the doctors do underestimate the importance of this. So I think it's important to make sure that all these persons who have a bleeding tendency are well diagnosed and then end up, in our hands as hematologists or blood coagulation specialists, so we can really confirm that there is an abnormal bleeding tendency and that we can identify what's responsible for this. Let's be honest, the blood coagulation process is very complicated. You have plenty of players.
I saw your presentation earlier explaining the cascading diagram, and honestly, you get a little bit lost.
Yeah, it's not only the cascade. Yes, we have the clotting factors, but we have the blood vessels we have the platelets inside. We have all these clotting factors who do a great work when they work together. And then we have all these mechanisms in place that do preserve the clot. So it's very complex. Sometimes identifying what's wrong inside this process is complicated. But clearly emphasizing the importance of diagnosis. Let's make sure that we do not underestimate or misdiagnose bleeding symptoms. I think this is a critical step if we want to improve the management of bleeding disease globally.
Amazing. Thank you for joining me today, Cedric.
Thank you. It was a great pleasure. Thank you.